But then, as I'm sure everyone knows, the exciting space of AI right now is something that is booming and growing, and I wanted to be part of that exciting space. And so, yeah, got the opportunity to be part of this awesome organization, Heidi.
How have you found them actually being in the room with like an AI scribe? Because not every patient these days
People are a
really
bit weird
knows
to the
much.
whole AI
Yeah, people are a bit
thing.
weird still about the whole AI scene. Like it's one of those landscapes where people kind of go, "Who's listening to me?"
Yeah. In this episode, we talk about how Heidi can strengthen the patient-practitioner relationship by cutting down on admin time and making the session more about the patient in front of them. This episode is perfect for both patients and practitioners who are keen to find out a little bit more about how AI softwares such as Heidi are used in the practice room. Whether you've been listening to the We Don't Know Yet podcast for a while or this is your first time tuning in, if you like this episode, it would mean the world to Zeb and I if you could give it a like, and also while you're at it, hit the subscribe button for more.
Whilst both Maddie and I are healthcare practitioners, we understand that there's no one-size-fits-all approach to healthcare. Should you require any medical attention, please seek out your local healthcare practitioner.
We'd like to take a break from today's episode to give a quick shout out to our sponsors, Drip Digital. They manage all of our audio and video editing as well as our social media marketing. Without them, the We Don't Know Yet podcast wouldn't be possible. So thank you again.
Well, mate, thank you so much for jumping on today. This is so exciting.
Very exciting.
Fellow osteopath or ex-osteopath in our presence. And yeah, a really interesting topic to discuss today. Maddie and I actually, over the last few kind of months, had been looking at the AI space going, I think an episode around AI would be amazing.
Oh, for sure. It's such a new space. And as we were saying off air, like there's just so much growth happening. It would be really cool, like from a healthcare perspective as well.
Yeah. And I think even just for like general pop, like everyday person who doesn't really know much about it, like great to unpack for them as well.
For sure.
Yeah, but mate, you're joining us all the way from Melbourne. How's the weather down there? It's not too Melbourne-esque, is it?
It's actually really nice today. Really nice. Just looking out on my screen at the window, it's probably like 20. Or sorry, I know it's 23. I can't tell it's 23. I know it's 23, and it's some blue skies, which is a nice surprise. But I'm sure there's probably going to be a storm or rain coming during this episode.
Yeah, actually, brief story really quickly. Yesterday, I was driving home from my partner. She's from country Victoria. I was driving home from the country yesterday, and it was like 30 degrees, 27 degrees, and we like hit Melbourne, and the skies just decided that for about 10 minutes it was just going to open. Thunderstorms, rain, like it was intense. And then about 10 minutes later, we like drove through the city and out the other side.
Absolutely
Nothing.
fine.
Back to 27 degrees and sunny. It was so rogue.
Very standard of this city. Very standard.
Oh, mate. But give us a little bit of a rough intro, I suppose, into what you're doing at the minute and
How you got into the Heidi space as well.
Yeah.
Yeah, absolutely. Well, firstly, obviously, thanks for having us, guys. It's very good to be here, and I'm excited to have a really good chat about AI overall, and obviously Heidi as well. But yeah, a little quick intro about myself. I'm an ex-osteopath, as you mentioned. So I was practicing in the clinical space for about probably just over 2.5 years, and then felt the urge that I had something else in me to go and achieve and explore, and so I made the move out of there into the health tech space. I was at another tech organization prior to Heidi. But then, as I'm sure everyone knows, the exciting space of AI right now is something that is booming and growing, and I wanted to be part of that exciting space. And so, yeah, got the opportunity to be part of this awesome organization, Heidi, and here we are, and thoroughly enjoying it so far.
Amazing. And look, I guess for anyone listening, I think we obviously come from the bias of working in healthcare, knowing what Heidi is, and even, using it pretty much daily from my end even. I guess for anyone listening that isn't, 100% sure of what Heidi is or Heidi Health is, how would you explain it? Like, what's the elevator pitch?
Yeah, for sure. Overall, Heidi is a medical AI scribe. What we are at the moment. That's definitely going to develop and change into the future, as I'm sure we'll probably speak about. But currently, Heidi's a medical AI scribe, and what that means is that you have the ability to have a virtual assistant in your consult room that completely streamlines all of your clinical documentation. So obviously, a lot of clinicians these days have to complete hours every day on their clinical notes, their letters, their reports, things like that. And with the use of Heidi, Heidi's able to capture that consult and pretty much create your clinical documentation for you in exact style, format, structure that you're after to personalize it to yourself. So obviously, the time-saving aspect is obviously huge, and I guess the quality of your care as well can be thoroughly improved. And I'm sure we'll continue to discuss this in further detail.
Yeah, because like it's probably something that's not really well known by the everyday person. Like when they go into the kind of the clinic landscape, they kind of get in there and go, right, I got 40 minutes with my osteo, I got 30 minutes with my osteo, you know, like in and out. Like they don't have anything else that they really have to do after that with me. Like there's no documentation or anything. But like when you're in your clinical practice, how much time do you reckon you're actually committing a week to, you know, just admin?
Absolutely. Yeah, it's a crazy amount of time, and usually obviously it's non-billable as well. So you're not really making any money off all of your admin needs and requirements that you need to complete. I guess from when I was practicing, and let's say we had a full day of patients, anywhere between, I don't know, 10 to 12 or 13 of patients, and usually majority of the day they'd be back to back. You've got very little time between patients to actually complete thorough, accurate clinical notes, which they obviously have to be. And you obviously then have to either at lunchtime try and remember what happened at 8:30 in the morning, or even at the end of the day, trying to remember what you did at 10 a.m. in the morning, right? And obviously at the end of the day, you've got 8 to 10, let's say, notes that you've got to write up, and potentially letters and anything else. So the time aspect adds up. I mean, for me personally, I definitely was spending anywhere near definitely at least an hour, closer to 2, just depending on what type of appointments I had during the day, whether it's initials and follow-ups. So it's pretty significant. It's pretty significant. And I'm sure, well, I guess I'll put it back to you guys. How much time are you guys spending on your clinical admin every day? If without Heidi.
Without Heidi?
Yeah, because I'm a without Heidi. I know Maddie's mentioned that she's like been tapping into the Heidi system.
A little bit of a
I'm a potentially new customer of Heidi, mainly because like I reckon majority of my day outside of like the clinical stuff at work, so lunch times, break times, I'm literally just like powering through. So and you know, because we're all there to help the patient that's in front of us at the end of the day. You know, I don't know a single osteo that you know, doesn't eat into their break time or eat into their, you know, next patient consult. Or half the time I'm like running out to reception going, can you just tell my next patient that I'm running like 5-10 minutes late because I'm like behind, because I'm trying to like get some stuff done with this patient that's in the room right now. So I think a lot of us as well like don't have that time to do the admin stuff because we're too busy trying to help the people that we're actually seeing in front of us.
Yeah, or even just like financial viability of the practice as well. Like we were always taught my sessions are about an hour in length, or 50 minutes to an hour. For every hour that you're seeing a client, there's at least an hour there of like admin follow up, which again, if you're seeing, I don't know, I see, let's say 15 to 20 clients a week on average. That's another 15 to 20 hours on top of that. Like it's a lot.
Yeah, and for your landscape as well, I feel like you guys would have to do a lot in terms of like prepping.
Very detailed.
Prepping like detailed management plans for patients, or like a lot of letter writing to GPs. For us, like it's more like just keeping a record of the actual consult, and like there's always the letter stuff that you got to do as an osteo, and writing exercise programs and all that kind of stuff. But yeah, like I can imagine for you, like you would have big treatment plans that you kind of have to really.
Yeah, I'm not necessarily a mental health professional, but working in the mental health space, any deteriorations or changes to someone's physical or mental safety have to be well documented and communicated, which takes a lot of time.
Absolutely.
Yeah, yes. So a long way of answering your question, but a lot of time.
A lot. Definitely a lot. That was the answer there.
Yeah.
Which is crazy. But yeah, I think it is that whole kind of element of trying to really get the best for your patients as well.
Yes.
And like I think that's another like problem that we kind of have is a lot of the time you do spend the time in the consult with the patient, but then there's a lot of conversation or chit chat that kind of happens during the consult that could be important for future consults, or even just like building patient rapport. Like I've got like little things that I might pop down here and there, like within the consult, just to recall or kind of chat about or catch up with later on down the line with the patient too. It can sometimes be nice, like even if something's taking care of all my admin stuff from the perspective of like treatment notes and stuff like that, I can spend the time that I would usually be spending on recording a lot of that. Just
Yeah. Helps you be more
taking down some,
engaged.
and build the rapport with the patient. Make sure that you follow their journey through life too, because that's part of it as well, is actually getting to know the people that are coming in to see you and stuff like that as well.
Even coming back to like the amount of hours that traditionally, like I guess a healthcare practitioner would spend on admin and notes and things like that, it's kind of a one-way street to burnout, in my opinion. So I think things like and developments like Heidi obviously reduce practitioner burnout, therefore it's better patient client care, that sort of stuff.
Yeah. Is there anything else that you guys kind of saw, or that the team saw when developing the product? Because I feel like there's a lot of like issues that come up across the day that, like sometimes even the healthcare practitioner might not be previewed to entirely. Like, what did you guys kind of look at, and what did you have in mind when the team started actually developing the product?
Yeah, well, I think the most important aspect of it is making sure things are completely accurate, right? That's the most important thing. Obviously, building a product and building an AI scribe product, you want the product and the output to be as accurate as possible. On top of the fact that as well, you want it to be customized to how you want your output to look like. So obviously, you're not going to find any benefit of using a scribe where you're then going to have to spend 10 minutes editing everything, because you may as well just written up your note from the get-go. So accuracy is obviously a huge factor of making sure how good a scribe can be for you. And obviously, as I said, the customization aspect as well, and the personalization. No one wants to be told how your clinical note should look like or how your letter should look like. You, as a clinician, want to make sure that it sounds like you, it acts like you, and it's your letter at the end of the day. And Heidi allows you to really get down into the nitty gritty of those template functionality to tell Heidi, how do you want that document to look like, and how do you want it to be structured, and what tone or what words and terminology. So like those two factors are probably the most important when it comes to the product and the building of it. You want to have a product that clinicians want to use.
Yeah, that's true.
And obviously we've sort of spent most of today already talking about, like, from a practitioner perspective, how Heidi can be so beneficial. I guess from a patient or a client perspective, how might they benefit in this scenario?
Definitely. I mean, we've seen firsthand. We complete these with organizations that are utilizing Heidi patient satisfaction surveys to see, I guess, what it was, what the consult was like prior to Heidi compared to what was with Heidi.
Yep.
And a lot of the feedback has been that because clinicians now are able to actually look at their patients and have that eye contact and that, I guess, really important sort of communication and body language with the patient, it makes the patient experience a whole lot better, rather than a practitioner looking at their computer the whole time and having to type up all these notes, right? Because they have to have these notes. You can't just think about it after the consult and try and remember. You've got to note it down. So
and I suppose as well, the patient doesn't actually like understand that side of it too. They're just like, why the hell is this person
so
looking at their
rude.
computer?
Yeah.
That's so rude.
Exactly. And so you can just appreciate how much more comfortable, I guess, you would feel in that environment when you've got someone who's meant to support you and take care of you through this process, looking at you and actually listening to you and being present rather than looking at a computer and typing away.
Yeah, I've never really thought about it from that perspective. And again, like, it's very rare that I'm often on the other side of it as well. But, health anxiety or social anxiety going to appointments is such a big thing. I can imagine that having like your practitioner be more engaged with you and, as you said, give you eye contact, help build that rapport, it would reduce a lot of the barriers to help seeking.
Definitely, absolutely. I think, and as I said, we've had and we've seen like the results from these surveys that patients really do feel that comparison between when practitioners are using Heidi compared to when they're not.
Yeah. Okay. And I guess if we were to get into the nitty gritty a little bit more, I noticed you mentioned at the start of today that Heidi obviously is like an AI scribe and documentation software. How does that work? Like, what does that actually look like?
Yeah, for sure. So, like getting into the nitty gritty, really, what the scribe means is that it's transcribing your consultation. And so it's capturing the audio from the conversation you're having between the patient and the practitioner,
Mm-hmm.
and it creates a transcript. So there's no audio recording ever stored with Heidi. We never ever store any audio recording. It's just the transcript. So it's just a whole bunch of words
Mm-hmm.
from that conversation. Once that transcript has been finalized, Heidi then is able to contextualize all of that information really, really well to then output that into a custom built template that the clinician has generated of what they're looking for in that output. So whether that is your initial consult template, whether it is a letter back to the GP, an EPC letter, a work cover, you name it, like whatever documentation any practitioner needs to create,
Mm-hmm.
Heidi has the ability, obviously, to generate that for you in the way and the structure that you like. And
Yes.
so the transcript is a source of truth. We also have an area where, like, it's called the contextual notes, right? You can provide Heidi any other information about this patient, whether it's results from any investigations, right? Any testing, whether it's referral information, anything that you want Heidi to know about past medical history, you put that into your context notes. You can even upload information as well, so that you can upload documents now. That's just been released, which is really exciting. So if you do have an MRI report, instead of typing out, copying and pasting it, you literally just upload that and give Heidi a little bit of context, and Heidi will take everything into that contextual section into context for its output as well,
Right.
in addition to the transcript.
Wow.
Yeah, that's great. So it's
Yeah.
sort of listens, transcribes, uses that sort of verbal transcription to create the notes and whatever else you want to create from that.
Yeah, yeah, that's at a very high level. That's exactly right.
Yeah, it was me
Yeah.
dumbing it down for my own sense, but it's okay.
And so as well, because so how have you found reception from patients? Like, have you got any feedback on some of that? I know, obviously, from the perspective of patient satisfaction in terms of engagement and things like that with the practitioner, I can imagine that that's a really big positive. But how have you found them actually being in the room with like an AI scribe? Because not every patient these days
People are a
really
bit weird
knows
to the
much.
whole
Yeah,
AI
people are a bit
thing.
weird still about the whole AI scene. Like, it's one of those landscapes where people kind of go, "Who's listening to me?"
Yeah, tinfoil hats.
Yeah.
Definitely, yeah, and anything like with this new world of AI can be pretty, for some people, it can be pretty scary, and they're hesitant to get involved. And I think at the end of the day, it's just all about education
Yeah.
and making sure that you, as a practitioner, firstly know exactly what product you're using, the security and the compliance behind it, and I guess the trust in the product to ensure that you can then obviously describe to your patient why you're using it and
Mhm.
why it's going to support yourself as a practitioner to be able to give them better care, right, and better
Yeah.
service. So, yeah, as I said, it's educating about how the product works, where,
Mm.
like, I guess on the back end, like where it's stored, what information is stored, the I guess obviously the compliance with all the privacy principles and
Yeah.
everything like that to do with healthcare in Australia,
Mhm.
and globally, if you're listening to this globally. So yeah, it's just giving them comfort in knowing how it all works.
Yeah.
Great.
Yeah.
And then I guess the next question is Heidi compliant and, is it regulated?
Absolutely, absolutely.
Yeah.
So um, yeah, this can be a really detailed long
How
convo.
far do we want to go?
Yeah. Rabbit hole.
Yeah.
But yeah, I mean, one of our biggest priorities as an organization, we've had it since day dot, is the security and compliance aspect of Heidi. We've got all of the certifications that I guess any big health system, public, private, hospital, you name it, will want to see when it comes to adopting Heidi. So a lot of the assessments, the security assessments that we have to complete, it gives us great confidence knowing that we're majority of the time always going to pass that. And so, yeah, when it comes to compliance in Australia and around the world, we've got all the security certifications, we've got all the other health compliance certifications, everything's on our website. I'm probably not going to bore your listeners with all those interesting certifications and
Yeah.
words compliance, but yeah, there's is the one of the biggest things is that we know as an organization of utilizing this product, clinicians need to trust the fact that we are secure and we are compliant
Mhm.
because otherwise no one's going to utilize us.
Yeah.
Obviously, health data and privacy and patient confidentiality is obviously massive, right?
Yeah.
No one's taking any risks with that. So
Yes.
it's one of our biggest priorities, and we're very proud of, I guess, where we are with it, and we're continuously, I guess, improving it and looking to ensure that we are, I guess, the most secure scribe in definitely in Australia, if not the world.
Yeah, yeah, 100%. And how have you found the uptake as well from like the regulatory bodies? Because as well, I feel like the typical patient doesn't realize there's a lot of like legal logistics with,
Hurdles.
the regulatory bodies as well. And like for all these, patient admin softwares and things like that, there's got to be particular criteria is met, like you said. Like, have you found the reception from some of those regulatory bodies like ARPA and all that stuff pretty good so far? Like it's like we said, it's kind of an evolving space or still quite a new space. So I'm sure like even them, like I can imagine like Osteopathy Australia and all that are still kind of like trying to navigate what it actually looks like moving forward.
Definitely, definitely. And I think like overall you've got ARPA, then you've got all the like the insurers, the MDOs, and everyone's supportive of AI scribes
Yeah.
overall.
Yeah.
I guess their biggest importance in to share with the clinicians and practitioners that are utilizing or looking to utilize it is a few things. Obviously, it's to make sure that you're using a really secure uh, and compliant scribe,
Mhm.
and they're compliant with APP and compliant with all the other things that they expect. Uh, on top of that is the importance of obtaining patient consent with your patients during those consultations as well.
Mm.
So, making sure you obtain that, whether it's verbal or written, the patient should be aware that you're using an AI scribe. And then thirdly, it's obviously the actual output, right? Making sure that you as a clinician are reviewing the outputs that the scribes are generating for you
Yeah.
before finalizing that into your practice management software or whatever software
Yes.
you're utilizing. So at the end of the day, the software that you utilize with all your appointments and your clinical notes, what you submit and finalize in there as a practitioner is
It's on
what
you.
you have finalized, right?
Yeah.
It's your documentation. That's the legal medical documentation that you've submitted. So it's always critical to ensure that you're reviewing the outputs to make sure it is what you expect for what your clinical note or letter is before you do finalize that.
Yeah, yeah. And with that as well, like obviously we've sung Heidi and just AI in general's praises so far. And it is such an exciting time, as we set off air, to be in the healthcare space or even just to be a human at the moment. Like AI is so exciting. I get really like, I don't know, I get my little nerdy hat on with like thinking about all the possibilities. But I guess in this context with Heidi, where do you think AI still needs some refinement?
Well, I think like there's all the actual technology is always going to improve and develop.
Yeah.
I mean, like Heidi's already pretty accurate, right?
Yeah.
Well, it's very accurate, and it's saving clinicians a lot of time every single day, streamlining their documentation.
Yes.
It's never going to be 100% because I guess that 100% needs to be the clinician giving it 100%.
Yes.
But if it can do 95, 98, 99% of the work for you,
Saving a lot of
it's
time.
it's pretty good, right?
Mm.
But I think that accuracy and the level of accuracy is going to continue to improve and develop over time as AI develops overall.
Yeah.
Yes.
Um, so
So it's like Heidi's using AI to the best of its ability, but it's on AI sort of
Yeah.
improve and
The tech
refine as time
space.
goes on.
Yeah. Yeah.
yeah, I think so. Yeah.
Yes.
Yeah,
Gotcha.
and just as well, like as I suppose as like more of these kind of like AI systems are starting to be developed, and like it'll just be that kind of optimization side of things, I suppose, versus anything too crazy in terms of refinement.
Yeah, exactly right. Exactly right. And I think overall, I mean, you can also get into the conversation about TGA and getting registered as a medical device, sorry. And I think this will be later down the track, not for Heidi, but just other products in general, obviously, that actually are recommending or diagnosing for for the clinician, right, and supporting
Yeah,
them with that. They obviously need to be registered as a medical device. At the moment,
yeah,
Heidi
yeah,
is it's simply just a support or an assistant tool with your clinical documentation. So
Gotcha.
there's nothing in the product that is diagnosing the patient with whatever they've come in with. It's simply just using that transcript of information and putting that into an output of how you would want your note to look like for you. There's no nothing being added or assumed or generated within there.
Do you think that's what's next for AI in the healthcare space, like that diagnostic element?
Stick element, yeah.
Definitely. It's already out. Like particularly, I guess, in radiology, for example, like there's AI products out there that are able to review a scan, for example, and recommend what it's seen within there to the doctor. So I guess it's definitely not replacing the doctor, right? The doctor still needs to review it all, but I guess it's possibly helping with potential any misses that the doctor might not see, but the AI can see and develop.
Yeah.
So there are already heaps of AI diagnostic tools out there.
Great.
And that'll just continue to develop over time.
Yeah, amazing. And from your end as well, what else is next for AI in healthcare or clinical practice?
Yeah.
A lot of things.
All of the things.
A lot of things. Again, like the world's your oyster when it comes to this stuff. So I think like overall, the basics could be with regards to like really deep integrations of EHRs and PMSs, and making, I guess, even further automations between those processes. So on top of just generating clinical note, there could be things that pop up with regards to actively creating a referral, because you said you're going to refer this patient to the cardiologist. So that referral is already generated for you and it's pretty much waiting for you to be sent. So like all of those process automations within the workflow, I think will be the most obvious developments in AI. But then there's also like developments with regards to digital assistants, I guess, within practices, and having AI agents support the admin staff and scheduling and intake, but also follow-ups, right? So like obviously as a practitioner, I did this. I'm sure many others do as well. Is obviously you've got a new patient come in, you've done what you need to do, but the follow-up is obviously really important as well. And so to have an assistant, which is AI, be able to do that follow-up for you, make sure your patients are contacted frequently. Is it how they're feeling? Are there any issues? I guess before they're coming into the next appointment, and having that scheduled and all automated. That's also something that's in the works and will be, I think, very, very helpful as well.
Yeah, yeah.
Awesome.
True. It's such a big world out there. What do you like? I'm trying to contextualize this for patients too, especially people who like come in. They're kind of like, is he going to listen to us the entire time? Like,
Yeah.
do we need to like hush out our conversation and stuff like that? Like while we're in the treatment room, and obviously I don't actually use Heidi at the minute. Definitely interested, but I don't use Heidi at the minute myself. Does it pick up on like everything that you're talking about in the console?
So I guess that's the beauty of it, is that it's a transcribing tool. So as I said before, it's capturing all the words, right? And it's creating that transcript for you. But because it's able to be able to contextualize all that information so well, it's only putting out what you've asked to in that template and what it believes is relevant. So I guess all the other conversations, which there's always a heap of conversation about.
General chit chat.
Yeah, general chit chat. Your wedding on the weekend, how's your dog, all that stuff. Right? Like it's not going to be inputting that in there unless you've specifically asked it to, right?
Okay.
So it can actually understand all of that, I guess what's important and what's not, and be able to filter all that out and do that really, really well.
Yeah,
Wow,
I actually had
okay.
a moment like that last week with a client. We went completely off tangent at the end of the consult, talking about dogs and what to feed dogs, and I forgot to hit like end record, and I was like, oh my god, is it gonna include all of that in the notes? And it didn't. I was like, oh thank god. Like it just would have been the most mixed match of like different clinical notes.
Yeah, because I was like trying to think about like how you'd actually go about it from the context of like recording it in session without,
Yeah.
like having that personal relationship
interaction.
or interaction with them as well, and then being like, oh my God, it's listening to me, I'm freaking out.
Yeah, no. It only includes what's relevant. I can definitely
that's amazing.
testify to that.
Okay, unreal.
Yeah, no, it does it very well. It does it very well, and I think that's also the most important aspect of like that relationship with patients as well. Is that you're not just talking about the clinical stuff and what's
Yes.
going on, right? You have to build
Yeah.
relationships with them, and you're I guess you're a human at the end of the day. So humans connect over different things, and being able to talk about the footy or to be able to talk about your son's wedding or whatever it was that's going on in your life external. It's really important to build those relationships with patients.
It's such a
Yeah.
paradox as well that utilizing artificial technology has allowed for more human to human connection in the clinical room. Like,
Yeah.
I don't know, is paradox the right word?
I feel like, yeah, like it's
It just
it's
ironic?
ironic,
Yeah.
or I don't know. But I
Pretty
understand what you're saying. It's kind of like, oh, how is using tech more like generating more of a personal
But it
connection with your
is,
patient?
yeah.
You know?
Strange.
Crazy.
It's pretty cool. I'm a big fan.
Yeah, well, we'd hope so.
Unreal.
And I guess with that as well, last thing, like I noticed you mentioned earlier, you had been getting some like user feedback from patients, like pre and post use of Heidi in the clinical room. With the feedback that is provided, how do you then utilize that to, progress or improve your the AI?
Yeah, for sure. Well, I mean, obviously, yeah, from a patient perspective, it's important what we hear from them. I think that's more so though they're what they feel between themselves and the actual practitioner
Yep.
and that relationship and how that's affected, I guess, the consult and the environment they're in, whether it's positive or negative. Majority of the time, as I said, it is positive. I guess the biggest thing is the feedback that we get from our users,
Right.
right? Um, we're obviously building a product for clinicians and by clinicians, right? Like 20%, I guess, of Heidi, if not more, are clinicians, so still active and non-active clinicians. So we're building a product for clinicians, and we want to make sure it's a product that clinicians want to use, right? And so feedback from our users is enormous, right? Majority of the features and the developments that we continuously build are based on the feedback that we get from our users and from the clinicians utilizing us. And we've got sort of like a dedicated area within the product where our users can provide their feedback about, I guess, what's going on at the moment within the product, but also any other suggestions of what they think will improve the product for themselves and for other users. And everyone can sort of vote along on there, and like we can see obviously if there's thousands of people that want this feature, it's obviously really important that we can start to implement that and develop that. So yeah, we always love feedback from our users to tell us what's working well, what could work even better.
Yeah.
Awesome.
Amazing.
Great.
Amazing.
I guess for anyone listening to this episode that is, I guess, contemplating using Heidi in their practice, but is still a little bit on the fence, as we said, AI is really new. What would be your main takeaways for them?
For sure. Well, I think it's obviously, as I said before, it's educating yourself about AI and particularly obviously this AI scribe and in healthcare and how it works, what it does, and I guess again the privacy and security aspect. So you are aware of that. But as I tell everyone, the best thing you can do is just give it a go.
Yeah.
Like once you have, I guess, trust in the product that you're gonna launch into, it's just giving it a go and actually seeing what it's capable of doing. And when I say giving it a go, you don't have to do it straight away with your patients, right? You can go home and do it with your sibling or with your partner and do a little mock consult and see how it works and how it can really help you. And that's what it is. It's a solution to provide clinicians time back in their day. And whether that's if you want to see another patient, go for it, right? Or if it's being able to leave at the same time of your last patient's leaving and go home on time and not have to think about all of your admin, then do that as well and
Yeah.
get some more time in your day. So yeah, it's just give it a crack. That's all I say.
Just
Just give
try
it a crack.
it.
Yeah.
It's the best thing. Once you see it in action, you'll be pretty surprised at how helpful it can be.
Yeah, huge.
Yeah, awesome. Well, thank you so much for jumping on today. I feel like, as we said at the start of today, it's such a new space. It's very exciting. Obviously, you've heard from two different people. One uses it, one is on the fence, not quite yet. But I think it's also interesting to like bring that dynamic into an episode to hear different perspectives as well. Like, obviously, I'm pro Heidi, pro AI, and then I think other people are a little bit more measured and need to know a little bit more information before they give it a go. So hopefully this helps bridge that gap.
Definitely, absolutely. And if anyone obviously has any further questions about us or what we do, how it all works, our website has a whole lot of resources, and you can contact us whenever you need. So please feel free to reach out and have a conversation with us about how we can help.
Amazing. And we'll pop Heidi's website and some more information as well in the show notes today too.
Yeah. Awesome, buddy. Thank you so much.
Thanks, guys. Pleasure to be here, and thanks again for having me.
No worries. Bye.
Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at we don't know yet.pod.
See ya.